Hi, this is Dr. Gharagozlou with Healthy Sleep Care. This is the continuation of our discussions about dreams. So we discussed about the function of the dreams and why we dream before. And today we wanted to talk about a specific kind of dream, which is nightmare. In my life, I have seen many people who have repeated nightmares. This has been very, very difficult for them to deal with it. Nightmares decrease the quality of life and how each person is dealing with their daytime because how they affect the daytime. Well, we have to differentiate between nightmare and PTSD nightmares and bad dreams. If we ask people, almost everybody are going to tell us that at some point in their life, they did have dreams with intense bad emotions. For example, a person was telling me about a dream that he was inside a chamber that looked like a room, but it was under the ground. And he was trying to get out of this place, but there was no way out. And he would explore different maze-like areas, and he couldn't get to a way out. And he finally felt he is not himself, and he is a bystander in his own dream. And the scene changes, and he is seeing his own self as a dead person. Obviously there is a lot of very intense emotion, and at the end of this scene he woke up, his heart was racing, and he was sweaty. And what if you have this dream thousands of times, and every night or every few nights you have the same dream? So it can be very, very devastating on your life, being anxious that you're going to have the same dream, and what you can do to get rid of this. The scientists think just a regular nightmare might be functional, the same as when we are trying to process our emotions that is related to our daily life memories, or we process our memories, we are dealing with a scenario that is generating a lot of bad emotions or unwanted emotions like sadness or terror or fear. However, this could be functional because your brain is trying to figure out different possibilities based on your prior experience and what you have learned in the past in your life, and try to figure out the meaning of a recent memory in comparison or in relation to all of your past memories and past learning. And that might evoke a loosely associated memory that, in comparison with the narrative that is happening inside your mind while you are asleep and dreaming, it makes a lot of bad emotion, and that's the way your brain is processing these memories. We know that eventually these bad emotions come out of the memories, and the way the memory is restored with less poor emotion, even though a lot of emotion will make sure the memory itself is restored in a way that you can remember it much easier. However, the dysfunction happens when the brain cannot take the memory and emotion and dissociate them and decrease the bad emotion of a memory. And we have seen that in people with higher level of norepinephrine, that is like wake, that happens, that the bad dreams become ongoing, become a recurrent problem, and then we see the norepinephrine level is high. These people are hypervigilant, hypersensitive. They are really focused on life. And let's think of a warrior. He knows to be hypervigilant. He knows to be sensitive to environment. His norepinephrine level is high. Even in the wake, we tap him from the back, you get a exaggerated response. So the same thing happens inside the brain while you're asleep and dreaming. And it's theorized that this hypervigilance and this high level of norepinephrine that is needed for somebody like a warrior or anybody for that matter can cause the emotions not to get extracted from memories. And also, on another note, brain is looking to make sense of things and to categorize memories and to put them with the rest of the group. And if the brain has difficulty making sense of a scene, making sense of a memory, then the problem is not solved within the brain. And the brain brings that memory back for solving. But if there is too much emotion, it cannot be solved, or you wake up and then it happens again and again and again. And we do see it in people with PTSD. So it becomes a problem. It increases dissatisfaction with life and all that comes with it, like suicidality. So we want to know what to do with this kind of trauma. Obviously, the trauma can happen because history of rape, history of being overwhelmed, history of divorce is a trauma, and it can cause recurring dreams or nightmares. And the narrative of this nightmare is important. For instance, we have seen women who went through a divorce, and their narrative of the nightmare empowers them and gives them control. They have less problems in future versus women whose nightmare narrative is with loss of control. So having said that, we wanted to see what are the solutions. And obviously there is psychotherapy that we talk and do therapy techniques, and there is medication. And this is as far as the current practice goes. Most of the time, we try to use trauma-related therapy interventions. CBTI is one of them for trauma, or CBTI for sleep, cognitive behavioral therapy, that we talked about it before, and they work. Another thing we want to do, we want to make sure the patient doesn't have other sleep disturbance, specifically sleep apnea, that is prevalent in obese, hypertensive male in middle age who might have nightmare, can be missed because of the doctor mind keep going into the treatment of nightmare, and sleep apnea is missed. Missed sleep apnea can be contributing in worsening of nightmares, and we have to make sure we don't miss that. There is a technique called image rehearsal therapy, or IRT. There is so many versions of it. Basically, in that technique, the therapist or the doctor helps the patient to change the narrative of the nightmare, what happens in the nightmare. For instance, you can change the color of a scene, or the thought that comes to your mind repetitively in a scene. Like, for instance, if you're bound in a place and you're really feeling very, very overwhelmed and powerless, that thought can be rewritten. You give the patient the choice to change anything they want. They practice the new narrative in wake. They write it down, they think about it, they talk loud about it. Before they're going to sleep, they practice that new narrative. And astonishingly, we will see that during the sleep, what happens in the dream also changes. So Very good results have been seen with the IRT, image rehearsal therapy techniques. Even you can eventually, in multi-stage, completely change the narrative of a nightmare and change the nightmare into a not nightmare. Change the emotions, change the story, change the plot, change the colors and scenes, and suddenly it's completely different. For instance, a nightmare can be, oh, I'm seeing a hand here. It can't be my hand because I don't have pain. So this is my comrade's hand, and we are in the middle of the old-fashioned man-to-man wall. And then he looks and he sees that his comrade is exploded and the hand is there. And he wakes up. And this actually happened in real life. So eventually, over multiple revisions, we can change this to, oh, we are having a coffee with that same person and he is very happy. And this is another image that we had with this person. So the person is there, the hand is there, but the hand is taking the coffee and the person is happy instead of sad. Obviously, this is a very wide change, and it happens over multiple sessions and a long therapy period. But obviously, having thousands of first dream rather than the second dream makes a difference in somebody's life. First, I tell what medications should not be used. We know Klonopin and Effexor are not recommended for nightmares. They are either ineffective or make the nightmare worse, so we don't want to use them. A large host of medications have been used in nightmare, but if you remember, we knew that high levels of norepinephrine in the brain can cause worsening of nightmares. So what about we decrease the norepinephrine? So a psychiatrist in North and Northwest America accidentally got reports that patients on prazosin have decreased nightmare, and they investigated it, and it turned out that yes, it decreases nightmares. There were some problems with the clinical trial, so it didn't get a very high recommendation, but prazosin or medications that can decrease the activity of norepinephrine are recommended for decreasing nightmares. There are a lot of other medications like Abilify or Zyprexa or gabapentin have been used, and it depends on the experience of the doctor and the rest of medications and clinical scenarios that a patient has to decide what medications can be tried. But again, non-pharmacological techniques are superior and better. Please do not miss any sleep disordered breathing in these patients that can worsen the nightmare, and take care of the rest of the PTSD, not just the nightmare, including day symptoms. If you have any question, I would be happy to answer. Please leave me in the comments any questions that you have and want answers, and we will consider answering them either in a separate video or in the comments. Thank you very much for your attention, and I see you next week.